Now, I'm going to be making a strong case for a medication trial if ADHD is properly diagnosed. This is based on the science. But whenever this issue is raised, parents naturally have questions, and they should. We should bring some healthy skepticism to using medication for children for any problem. And there's some questions that I need to answer for you to feel comfortable with the medication trial for your child. For example, often we're asked, isn't ADHD overdiagnosed? Well, it sure can be overdiagnosed, as I'll discuss, but it also can be underdiagnosed. The idea is to get the diagnosis right and then proceed with the most effective science-based treatments. Another common question, aren't children with ADHD over-medicated? Let's say you've made the right diagnosis. What about trying behavioral strategies, educational strategies, alternative treatments before medication? Why not use medication as a last resort instead of as a first resort? As we'll discuss, the science supports using medication for ADHD, not for every other neurodevelopmental condition, but for ADHD, medication should be considered as a first-line treatment. More on that to follow. How about another question? Isn't my child too young to be diagnosed? Well, we should be cautious about younger children. Have we made the right diagnosis? Can we help with behavioral or environmental changes? So we shouldn't leap to medication trial in preschoolers, but there is a mountain of evidence supporting carefully controlled medication trials for ADHD in preschoolers, just like in school-age children and adolescents. More on that to be discussed in this excursion. Another question, what about treating ADHD without medication? I've already touched on that. And there are some treatments that show a little bit of effect size, but nothing as good as the medication that we're going to be discussing today. These are not my opinions. This is based on carefully controlled research, which I'll be sharing in this excursion. So I hope by the end of this discussion you've got some good answers to these very, very good questions.